Hi, I'm Keaton, and welcome back to HealthyMarks Medicare. Today we've got a really special video. We're going to talk about San Diego Medicare and everything you need to know about it for San Diego County. It's important to remember that our team at HealthyMarks Medicare is excellent at helping you enroll and find the right plans for you and your family. In this video, we're going to talk about Original Medicare, eligibility, enrollment in Original Medicare, as well as your options between supplement insurance, as well as an Advantage plan. And then we're gonna talk about how your prescription drugs will be covered. And from there, we can talk about specific carriers in San Diego and some of their benefits, so why you might select that carrier. At any point, if you wanna jump to any point in this video, you can see the different areas down below here. Let's first talk about eligibility and enrollment. So you are eligible for Medicare 3 months prior to your 65th birthday month. So for example, my birthday is in March. So that means December of the prior year, December 1st, I can enroll in Original Medicare. Now my plan will start March 1st, the first day of my birthday month. So that gives me 3 months to sign up for Original Medicare, get my Medicare card in the mail, and then select either my supplement or my Advantage plan on top of that. I have learned that it's very important to sign up for Original Medicare early in your eligibility period. It often takes the Social Security Administration's office a bit of time to process your paperwork and get you your Medicare card. Without that Medicare card, you won't have your Original Medicare number, and you cannot then sign up for a supplement or an Advantage plan. So it's important to get to that step first. Original Medicare consists of 2 parts. Parts A and Parts B. Part A is your hospital insurance, so any inpatient major medical treatments. Whereas Part B is your doctor's office or outpatient care. When you sign up for Original Medicare, you should sign up for both Parts A and Parts B, unless you are looking to continue your current health insurance plan through perhaps your employer. Our team is excellent at evaluating both employer and Medicare plans. Honestly, Medicare plans are excellent. They're inexpensive and cover a lot of your major medical treatments for very little cost. Medicare is great, but also there are great plans from either small businesses and large businesses, so we'd be happy to help you evaluate those options as well. So, to enroll in Original Medicare, you're gonna wanna go to socialsecurity.gov. You'll answer a couple of questions, you'll select to enroll in both Parts A and Parts B, and then you're gonna do the waiting game. We're gonna wait until they send you the Medicare card in the mail. So now that you've enrolled in Original Medicare, it's time to evaluate your second step options, either the supplement plan or the Advantage plan. Even if you don't have your Medicare card yet, it's good to start evaluating these options early so you are ready to enroll when the time comes. Let's first talk about Advantage plans and some of their benefits. Now, an Advantage plan is most similar to an HMO plan in the sense that you'll need to select a network of doctors to stay within. So for example, you might select Scripps Coastal here in Encinitas, or a Sharp network of doctors. Now within that network of doctors, it's important to remember that these Advantage plans are excellent at any care you might need. So don't feel like you're missing out on something by selecting an Advantage plan and being limited to a network of doctors. The main reason that people select an Advantage plan is because it's gonna be able to bundle all of your services together. So you'll have that network of doctors, and within that network of doctors, you'll be able to get all your medical care, your prescription drugs. They often bundle dental, vision, and hearing as well into that one plan. So it's kind of a one-stop shop for all of your needs. These plans often have a deductible associated with them, and then an out-of-pocket maximum, meaning that you're paying a low amount each month with your low monthly premium, but you will need to pay for some major care out of your own pocket, sometimes up to $2,000 or even $4,000 in any given year. So again, Advantage plan, all of your bundled services in one area with a network of doctors here in San Diego. The other option is to select a supplement insurance plan. Now these plans are extremely robust. They provide excellent care, and you can have access to doctors throughout the entire United States. So it's a nationwide network of doctors when you select a supplement insurance plan. Just on that information alone, if you've got a house here in San Diego and maybe you also are commonly vacationing somewhere else in the country, a supplement plan is going to be the best one for you so that you can be covered in both of your homes. So along with your supplement plan and your nationwide network of doctors, another major benefit is that when you do have any major medical treatment, you're gonna pay almost no money at all. So yes, you are paying more in monthly premium with the supplement plan compared to an Advantage plan. But when you do, say, have maybe a knee replacement, you're gonna pay very little out of your own pocket. I often hear stories of people saying, I went and got my shoulder replaced and it only cost me $200. That is a supplement plan story right there. Let's quickly review our costs for both Original Medicare, Advantage, and supplement plans. So everyone's gonna enroll in Original Medicare. Part A is often entitled to you, meaning that you've been paying your taxes throughout your life here in the United States, and you are entitled to that plan at zero cost to you. Part B is gonna cost $158.50 in 2022. That's a $10 increase from last year's $148.50 for 2021. As I said, Advantage plans are relatively inexpensive, so you'll pay your Part B premium, and then your Advantage plan may cost only a few dollars all the way up to maybe $100, depending on how robust an Advantage plan you want to select. On the flip side, a supplement insurance plan is going to be a little bit more pricey. So you'll continue to pay your original Part B $158.50, and then you'll select a supplement plan. Often people select Plan G, it's one of the best, and that ranges between $100 and $120 a month based on some welcome savings depending on which carrier you select. On top of that supplement monthly premium, you're also gonna need to select a Part D prescription drug plan. I said earlier that the Advantage plan is gonna bundle your prescription drug services in that one plan. With the supplement insurance plan, you need to buy an additional coverage, a Part D prescription drug plan. Now, depending on which prescription drugs you're taking, maybe you're only taking generic drugs. You could find a plan that's relatively inexpensive, maybe $10 or $20 a month, that will cover those generic drugs. If you're taking more complex drugs, you might need to spend nearly $100 a month on your prescription drug plan to make sure that those complex and expensive drugs are covered properly for you. So now you're seeing that the supplement with the Part D prescription drug plan can be quite a lot more expensive than the Advantage plan. There are a lot of insurance carriers that provide Part D prescription drugs. Some carriers will cover your prescription drugs as generics, while other carriers will say that drug is a preferred and it will be more expensive with that carrier. Our team would love to help you with that. It's very confusing to do this alone, but our team knows exactly how to find which prescription drugs are gonna be covered for you on which plans, and will help you select that carrier. In summary, we've signed up for Original Medicare. That costs us $158.50 a month. We then wait for our Medicare card to come in the mail so that we could use that Medicare number to either sign up for an Advantage plan or a supplement plan, and then with that supplement plan, we'll tag on a Part D prescription drug plan to cover our prescription drugs as well. That's a great summary of how Medicare works here in San Diego. Now let's take a quick look at some of the carriers that provide Medicare services here in San Diego and some of their benefits so that you can have a quick snapshot of which carriers are going to be best for you. HealthyMarks Medicare works with every carrier here in San Diego. So you'll never feel like if you work with us, we're going to be pushing you towards a specific plan. The only reason we at HealthyMarks would suggest a specific plan is if you provided us with information that suggested that to us. So for example, let's say you've already been working with UnitedHealthcare the last 20 years, and they've already provided prior authorization on a very specific prescription drug of yours. So if you're already comfortable with, say, UnitedHealthcare, then we would like to help you enroll with them so that you're not pigeonholed into any specific carrier. Let's start with UnitedHealthcare. They're so popular because they have a robust number of supplement insurance plans available to you, as well as Advantage plans. And they're the only carrier that provides Advantage plans for both Sharp hospitals and Scripps hospitals. Remember, you'll have to select one or the other when you enroll because it is an HMO type plan with this Advantage plan. One of the major benefits of working with UnitedHealthcare is that they'll be able to bundle your services into one plan. So even if you do select a supplement plan, they have really easy add-ons for dental and vision, as well as hearing aids and other wellness programs. They offer a gym membership through Renew Active for all of their members. The second carrier I would like to highlight is Scan. Scan provides a really excellent Advantage plan for Scripps hospitals. So if that's the hospital system that you want to work with, I would highly recommend a Scan Advantage plan. The Scan Advantage plan offers the lowest out-of-pocket maximum for Scripps hospitals. And on top of that, they do have some bundle services as well, dental, vision, hearing, and they provide access to Silver Sneakers, which is a very popular gym membership for a lot of Medicare enrollees. Next up, we've got Blue Shield, another very popular nationwide carrier, and they provide a lot of plans here in San Diego. You'll have access to great Advantage plans with Blue Shields, and also their supplement plan is one of the best. They offer new Medicare enrollees a lot of welcome discounts, including your first year on Medicare discount. If you and your spouse enroll together, there's a discount for that. And if you enroll in a dental plan that is through Blue Shield, that will provide you with additional savings as well. So they do a great job of bundling services and offering ways for you to lower your monthly premium with welcome packages. Blue Shield has some of the most robust prescription drug plans here in San Diego. They offer coverage for a lot of very expensive drugs, but it's important to note that if you signed up for a supplement plan with United Healthcare, you can always sign up for a prescription drug plan with Blue Shield. Now, Blue Shield's prescription drug plans are excellent, but that doesn't mean you have to sign up for all Blue Shield if you don't want to. You could sign up for a United Healthcare supplement plan and then pair it with a Blue Shield prescription drug plan. And that's a perfect example why it's great to work with a professional Medicare broker so we can help you navigate each of those carriers, including each of those carriers' prescription drug plans. Similar to Scan, these Blue Shield plans also provide access to Silver Sneakers, that very popular gym membership for Medicare enrollees. Anthem is also a unique carrier for Medicare here in San Diego. They offer supplement and Advantage plans, but they have some really unique PPO Advantage plans. So that means you have a network of doctors, but you can see other doctors outside of your network for additional costs. Pretty interesting Medicare plan and very unique to Anthem. Anthem does a good job of bundling their dental, their vision, and their hearing aid benefits along with their Medicare plans. And you have access to that Silver Sneakers gym membership with Anthem as well. Lastly, I'd like to mention Kaiser. If you would like to enroll in a Kaiser Advantage plan, you'll have access to Kaiser's facilities here in San Diego, and they can do a great job of providing you care within their network. So that's a good highlight of some of the carriers here in San Diego that you can work with Medicare. And I'd like to mention that the best carrier is the one that you're comfortable with. We have access to all of the plans here in San Diego, and we'd like to present them to you in a very unbiased way so that you and I can figure out what the best plan is for you and your family. Now, before we wrap up our conversation about Medicare here in San Diego for the year 2022, I'd like to offer you one tip, one great advice as you evaluate your Advantage and your supplement plans. It's this idea of pre-existing conditions and whether or not you will qualify for a supplement plan. When you enroll during your initial enrollment period near your 65th birthday, there is no medical requirements for you to sign up for a supplement plan. You will not need to visit a doctor, and you will not need them to provide prior authorization that you are healthy enough to sign up for a supplement plan. But if in the future, in a few years down the line, you'd like to move from an Advantage plan to a supplement plan, that's where pre-existing medical conditions do come into effect. Oftentimes, it is a good idea to move over to a supplement plan. You might be able to get more robust care for a specific treatment that you're looking for. However, if you already have an Advantage plan and you're looking to move over to a supplement plan, you will have to visit a doctor and get a medical screening to show that you are healthy enough to sign up for that supplement plan. Now, if you'd like to learn more, we have an entire video library for you to browse so you can learn more about health insurance or your Medicare options here in San Diego. So thanks again for joining us here at HealthyMarks Medicare. I'm Keaton. I would love to help you enroll in your Medicare plan, so please give us a call. Thank you.